Now we're being recorded. So welcome to the class on ADHD. We do a class here at our office once a month, sometimes twice a month. And we switch subjects. We have thyroid, ADHD, a few different Lymes we're doing next. If anybody's interested in that, we have some flyers for our Lymes class. I'm Dr. Bircher. This is Dr. Martins. And first of all, I wanted just to ask a quick question of why you're here, so we can make sure that we cover why you're here and answer your questions. And I'm going to go for about, when we get through with the slide, about a half hour, and I'm going to open up to questions about what we talked about. So just why did you come?
I have a 7-year-old that has ADD and currently is taking medication. Does not seem to be giving us the results that we want. So I'm looking for something else.
Okay.
I actually brought her along. My daughter here has ADHD.
Okay.
She's not physically hyper, but her mind is very hyper. And so when you were talking in the local blurb on Facebook about, you know, the brain mapping and stuff like that, it really intrigued me.
Okay. Anybody else?
Maybe my mom.
I just saw it looking on Facebook, and I was looking at
Okay.
maybe possible ideas for my 14-year-old who, you know, isn't diagnosed, but I think there's just things going on. I don't want to go the medication route, but also I'm a speech language pathologist, so I thought maybe some of the things I see will work with him. Maybe I can incorporate some of that with my parents that I work along with. So.
Sure. Okay. Yes.
I have an 18-year-old who is on Concerta, and we're kind of questioning whether she needs to take it
Okay.
with college next year. I have concerns with that, so.
Oh, that's a good question. We will talk about
Yeah.
that.
My
Sarah?
little guy is 6, and he's going through the process right now of being diagnosed with
Evaluated.
whatever he may have. Focus issues are his problem, so we're thinking ADD, but not physically hyper, just cannot focus, looking all over and just his teacher's
Okay.
going nuts.
All right. We'll make sure that we get those questions answered, and then we'll also leave some time at the end to answer questions. But just a quick thing about myself, I'm Dr. Bircher, been in practice for 33 years, studied functional neurology and functional medicine. Notes are available. And just talks a little bit about my background education. This is?
I'm Dr. Martins. This is not my, you just
I
skipped
see.
through it. I didn't have my slide up here. I've been here for about a little over 3 years, getting certified in through the American Functional Neurology Institute, nutritional counseling, board certified integrated medicine, do physicals for the DOT, and various other things. So.
And our goal tonight is just to educate and inform the public about what we do, what's available, and how it can relate to, you know, kids' lives especially, and to establish just some professional relationships. Like, we're interested in working with other people, speech pathologists. We want to make sure that our approach is a more naturally based approach, but we also want to, I like to start out saying that I'm not against the medication, because sometimes the medication does work, sometimes it doesn't. It does have some side effects. And the way I personally look at medication is, do the benefits outweigh the risks? Sometimes they do, and sometimes they don't. And if they don't, there's a lot of natural ways of doing things without medication, which is mostly what we do. So we're going to talk about those. And we combine brain-based therapy, functional neurology, with functional nutrition to find out what the person needs to feed the brain and make sure that we can test the brain to see what it needs. Like she mentioned, we do brain mapping to find out how the brain is functioning. We also do neurological tests and some biochemistry testing, urine, blood, saliva testing to find out what the body needs.
So, some of the main sources that we do, there's neurofeedback demos, there's handbooks on neurofeedback, Symphony of the Brain by Robbins.
These are books that are available from Amazon library.
20-hour solution ADD, ADHD, introducing the cognitive EEG or quantitative EEG and neurofeedback, healing ADD. Amen. That's a good book. So you can see all three of these. I won't read them all, but there's a lot of really good ones. Martin's good. Stoller Hill's good. Springle on the next slide. He's really good.
The last one, Anatomy of an Epidemic, I've read that book. It talks about how medication has created an epidemic of drug problems. And he does a great job if you're interested in that. That's a great book.
We kind of get into that a little bit later in this too.
So basically, one of the things that we use is biofeedback, also called neurofeedback. And as we go through, we'll see a few of the terms called neurofeedback, and it's just a type of biofeedback that uses brain waves. And how it actually works is we, first of all, a map she mentioned, we put a hat on your head with 10 leads on it, and we actually measure the electrical signals coming off of the brain. The leads don't put any energy into the brain, it just measures electricity coming off, and it also reads the frequency of the brain waves coming off so we can know how the brain is functioning. And we use that, which is officially called quantitative electroencephalogram, and from that map we can tell what the brain needs to come back to normal. If it's an attention problem, or if it's a focus problem, or if it's a memory problem. And from that map, we also can choose some cognitive tests. And we just started doing the cognitive tests a while back, and I've done a few on people, and it's amazing. Kids that were diagnosed with ADD, the first one that I did the cognitive test on was classic. He did the attention test. He scored a 99 out of 100. Attention's not his problem. He has a memory problem. He forgets too quickly. And so he's labeled with a label, but that doesn't mean necessarily that that's what he has. Like she mentioned, it might be a focus problem. It might be a sequential memory problem. And so there's ways that we can test through our brain mapping and also actual cognitive testing to put a proper label on what's going on. This label of ADD is kind of a label, well, if they're not functioning well, we'll do a few tests and we'll label them as ADHD or ADD. And in my experience, probably half the time that label's not correct. And so we have the ability to refine what it is that we're testing to know exactly what the person needs.
So biofeedback, has anyone ever heard of biofeedback? Okay. So if you have an idea of biofeedback, it's similar to neurofeedback because it uses a biofeedback system, but biofeedback is changing patterns kind of through, I don't want to say meditation, but meditation is a way of doing it. So like changing heart rate, you know, by breathing techniques and things like that, where neurofeedback is kind of a similar thing. It's a positive reinforcement feedback measured by the computer, sending back the right brain waves. So again, self-regulation of brain activity has been practiced for a very, very long time. And again, you can see meditation, yoga, martial arts, things like that. And it's just being very self-aware kind of how your body's functioning. And you know, most recently it's probably really blown up. The reason why may or may have not have heard of it, even though it's been around a real long time, especially neurofeedback, is because it took computer technology to really make it effective.
So biofeedback is a term that was popular when I was in college a long time ago. 35, 40 years ago, there was a lot of research. In fact, Stout did a big project where they took temperature biofeedback, where you put just a temperature sensor on your fingertip, and basically with your mind would raise the temperature of your finger. And with practice, you can do that. And what they used it for was migraine headaches. Very effective. And there was a big thing in the newspaper about how great it was, but you didn't really hear about it much in practice because we have some temperature biofeedback units in the back. I've tried it, and I've had people try it. The reason it's not very popular, it's really hard. It's hard to focus on your finger and raise the temperature of your finger. I've done it. It takes a lot of work. If you can do it, you can correct migraines. Very interesting tool. So as Dr. Martin said, how it became really popular is when computer technology came online, because we can actually hook leads to your brain and put the brain waves up on a computer screen, and we can use different techniques, games, watching a movie, and we'll explain that a little bit more in a minute, and just teach your brain how to move to the correct brainwave patterns to improve focus, attention, memory, whatever the issues are. So it's a form of operant conditioning. It just gives the, like he said, the brain a positive feedback to move the brain to the right brainwave pattern that you're looking for. So it just leads to cellular changes at the brain cell level and creates new connections between brain cells. In essence, it's an exercise program for the brain, and when you exercise the brain in the right brainwave patterns, it learns them and remembers them, and they'll stay that way forever.
So when you train the brain, it tends to stay trained, okay? But it is, like Dr. Percher said, it's a muscle. The brain is a muscle. It's not typically just one session. You don't go to the gym, you know, do bicep curls and expect to have 40-inch biceps after that one session. You got to build that, and then it'll stay, okay? They don't degenerate that fast. And we'll talk about that later, how long it typically stays. So physical trauma and emotional trauma can be an issue that, you know, can set back or make things last longer. Major emotional traumas such as death, divorce, or major move, stressors. Stressors that don't leave sometimes can mean more visits. Again, everyone's different. Every brain is different, so you don't always know what's going to affect the brain. But those are things, you know, we got to look at in life and possibly make some changes too. So it's been studied. It increases IQ, you know, around 10 to 20 points. Again, that's in that book by Swingle, which I recommend reading. It's a very good read. Can cause structural changes in the physical makeup of the brain. You know, if a lot of you probably have heard of neuroplasticity. Okay, think of plastic. It can mold, it can change and shape it. You know, so same thing with the brain. It is not, once it's developed, it's not like it just stays there. It can change, and it can change quite easily. It just takes something to change it, an exercise or something like that, or memory games or something to change it, and it depends how you want to do it. And it has been shown in the plateau of strokes, you know, people who have had like strokes or other brain injuries, Parkinson's, MS, things like that, because all those people typically have one thing in common: brain degeneration, you know. Alzheimer's disease, again, typically the person who has Alzheimer's disease has 10% less white matter in their brain, statistically. And so that degeneration, again, it's a muscle. You want to build it back up, and a lot of times you'll see either slower progression of those type of diseases, or even some cases, some reversals.
And it talks about the effects of neurofeedback can last up to 30 years, and the reason they say 30 years is because that's how much time they have data. So there's research on 30 years. The experts say that once the brain is trained, unless you have a concussion or some major thing, it should stay that way the rest of your life. And so it's a long-term effect. So we're just trying to get, this is an example of a picture of what the hat looks like on the picture on the right-hand side. It's just a little hat put on with 10 little sensors on there, and it's hooked up to the computer. This is what a brain map looks like. It has, there's 4 different pictures of the head, essentially, with 10 different dots on it. And the dots have different colors for the amount of electricity coming off of the head. And the 4 different pictures you see have to do with different wavelength patterns. There's slow brain waves on the left, and as you go to the right, the brain waves get faster. Commonly, the slower brain waves, like delta is called, is sleep brain waves. And then you'll see theta, which is more of a meditative state. Alpha is more of a focused learning state. And then beta is the higher functioning, where you're thinking about things, learning. You're driving a car, as an example I use, of beta waves. Your brain's doing fast thinking, looking, signs, turning. So your brain needs to be going faster when you're doing faster activities. So it measures magnitude of the signal coming off the brain and also the frequency of the signal coming off of the brain. These are just an example of what the colors mean. And those, again, come off the report when we do a brain map on somebody. So the brain waves, when we do a test, what we do is we hook our computer is linked to a computer at the University of Maryland, and they have the largest normative database of brainwave tests in the world. And then your test is examined compared to all the other tests, and they have known normals. So the report comes back from them, and we pay them to do that for us because they have all the data and they have the research behind it. So when we get a map back, the accuracy is very good. We know when we test somebody, there's one of these circuits on the computer that we use, it tells us if the leads are hooked up correctly. So the accuracy of the brain maps is very high, and the examiner reliability is also very high. So we know the validity and the accuracy. So just a quick history of quantitative EEG. Started back in the 50s as part of a NASA study. They wanted to study what would happen to astronauts' brains in space, and they're still doing work on the effects of astronauts in space. And the reliability we just talked about, it's between 90 and 99%. And I can tell you, I know that traditional tests that are done to diagnose ADD, the reliability of those tests, not very high. This test is very high, and then we follow it up with the cognitive tests. I'm going to say it's a 99%er. So we can tell you exactly what's happening with the brain and what to do about it. And then when we do neurofeedback, we can remeasure it and make sure that it's correct.
Neurofeedback has been shown to help many things, like I mentioned before, like ADD, ADHD, autism, OCD, addiction, anxiety, Asperger's, insomnia, personality disorders, depression, so on and so forth. A lot of things if you can link it to a cognitive problem, and if you do a brain map and if it shows something's going on there, and a lot of times there's patterns with certain things, you know, like ADD, ADHD, things like that, and that's a lot of times a good way to treat some of those conditions like insomnia. I mean, great success with people with insomnia. Or, I have one patient who, you know, her psychologist tells her, she's got a looping disorder, and that kind of causes her anxiety and then causes her problems to sleep. And she does neurofeedback, and it's like, boom, gone. So, and I think it was a short number of sessions, but no problems.
Sometimes it's quick, sometimes it takes a while, but it's very effective.
Yeah.
And it helps cognitive decline, closed head injuries, athletic performance. And what they mean by cognitive decline is just people start losing memory, and which is the first stage of dementia. And then dementia tends to lead to Alzheimer's. And what neurofeedback says is if you can test the brain when it's starting to decline and improve it, then you can prevent dementia and prevent Alzheimer's. And I've worked with people with Alzheimer's who have a frank, diagnosis of Alzheimer's, and nobody has anything that I know of that can help it. Once the brain cells die in Alzheimer's, they're not coming back. So the key is treat them when it's starting to decline, treat them before Alzheimer's comes around. Neuroplasticity, already talked about. Types of ADHD. One of the books that was on our book list, Dr. Amen's book, he talks about the different types of ADHD and has a very specific definition of the different types of ADHD. What we do is we test each of those types, and we can tell you by the map and the cognitive testing exactly what it is. And some of these statistics, you have these, but I think these are important to put out. Large portion of kids with ADHD will be arrested in their young adult lives. It's the statistics are kind of frightening. Most kids with low beta have a greater chance of becoming delinquents. Adults with ADD have a higher chance of getting depressed. And most of the kids that have a frank diagnosis and functioning of ADHD, if they don't get it corrected, 70 to 90% of them have significant problems in adulthood. And you'll hear the term now, they talk about adult ADD, and it's definitely a problem.
And that's some of the problems with medications is that, you hear a lot of people who take medications, they don't feel normal, so they don't want to be on it. And then, or if they're on it, a lot of times even into adulthood, they are, like the study showed, delinquents. And, so it's a major problem later even in life, so.
Now, this is a statistic, the top one, but if you read the Anatomy of an Epidemic book, he goes into that at length. And I don't even like to think about that book after I read it. But basically what he talks about is that ADD medicine, ADHD medication, has led to an epidemic of adults who are hooked on medications and have cognitive decline because of long-term use of medications. Because what the studies show, and we'll get into that in a minute, taking the medication for ADHD doesn't fix anything. It's not a cure or a correction. It's a temporary stimulant to the frontal lobes to increase beta, which can help sometimes. But you take that away and then that effect is gone. And so it doesn't fix anything in most cases. And the number of people who have those issues is continuing to climb. And it's we'd like to do something about those numbers and decrease them. So what they found in this study, which is I think a very important study, they took 100 kids and they were, the ones that were diagnosed with ADHD, half of them got medication and half of them received medications with neurofeedback. And when they took the medication away, like it says here, the improvement went away. But when they had neurofeedback, which according to the American Academy of Pediatrics is recognized level 1, which means that the science supports that it is a valid treatment for ADHD. And they say that the neurofeedback is at the same level as medication, that it's as good as outcomes as the medication, but there's a huge difference. They're talking about the short-term outcomes of symptom relief. The medications do relieve some of the symptoms, but that doesn't last, whereas neurofeedback is permanent. And there's no medication side effects, and there's no problem in the future, because a lot of these kids that have medications who stay on them as teenagers have problems later on. So how much does it take? This is a study done in 40 sessions in Spain, and there's studies all over the world. In fact, neurofeedback literally has hundreds or thousands of studies done on it that show positive results and no negative effects and no side effects. There's very few therapies in healthcare that have thousands of studies that show positive effects and no negative effects. And when you hear those numbers, the first question I had in my mind when I studied neurofeedback and heard those numbers is, well, why isn't it more common? And the answer is real simple. It's not more common because there's no drugs to sell. There's no big money in it. And unfortunately, that's the case these days.
And it took computer technology to get it popular to this point too.
Right.
I mean, it did take some of that.
It took a while for that to be able to apply it in a large scale. And so we have a proven alternative to medication. And then the logical question is, what causes it?
Again, environmental factors, DNA, genetics, traumas, injuries, anything to the head, physical traumas, and again, to the frontal cortex. Inflammation, autoimmunity, hormonal imbalance, nutrition, reactivity. One of the leading neurologists in the nation on ADD and ADHD treats 95% of his patients with no medication. It's a lot of nutritional things. There's a pediatrician actually in this area, I don't know, a few months ago, if anyone was watching TV 18, she was on TV and showing her neurofeedback machine was actually our old model. So she's not even using the most up-to-date one, the one we used, 3 years ago. and that's the one she's using. This one's way more effective because it was our exact old model. Not our, we didn't sell it to her, but it was our same machine. So it is becoming more popular around here. Again, traditional ADD is that these kids and the adults will seek out stimulation to increase their beta levels to normal. So that's the thought process.
And what they're talking about is on the brain map, traditionally a ADD pattern on the brain map is that beta levels, the frontal beta levels are low, and the beta brainwave patterns in the frontal lobes are what give you your cognitive abilities and your ability to choose. And ADD kids all have low beta. And so what the medication does, you mentioned your child's on medication, those medications are stimulants. And in the old days, and when I was younger, they used to call it speed. Now they have fancy names for it, but it's a medication that just stimulates the frontal lobes to increase beta levels. So when they're low, doing that can be helpful. But again, it's a stimulant that's doing it. And it stimulates other parts of the brain, and it causes brain imbalance also. And then what happens is that when you see some of these kids, and I just saw one of my ADD kids this afternoon, in the past, he's much better now. When I first started seeing him, it was hard to even see him when he came in for treatment, because he's just always, he irritates people and irritates his parents. And one of the things we learned in class was, why do kids irritate their parents? Because when they get a response from their parents, it stimulates their beta waves in their frontal lobes and they feel better. So you'd think it would logically make sense. Why would a kid do something bad over and over again and get punished for it and then do it again? Because it actually raises their frontal beta and they feel better when they do something stupid and get punished for it. And then they'll keep doing it because they actually feel better in their brain by doing it. It doesn't make logical sense, but when you understand the physiology and the neurology of it, it does make some sense why they act inappropriately a lot. Side effects, we talked about that. There's a lot of side effects: sleep, headaches, jitteriness, and depression, anxiety, and suicide is a problem also.
I think one of the things that was in a previous slide too, and that I thought was important to mention, one of the side effects is usually, some do a little bit better in school, but the neurofeedback has been shown, in studies to increase those school skills, math, reading, things like that, way more so.
One of the researchers, Dr. Lubars, did lots of studies, but he believed that when the brain is trained with neurofeedback, it actually when you increase brainwave patterns, you increase blood flow to the brain, which is what it needs, especially in the frontal cortex. And then when you give nutrients to the brain, it will form new connections and keep getting better. Whereas a lot of kids that we see, we do lab tests on them, they're deficient in things. They're deficient in oxygen, some of them. Some of them have blood sugar problems. Some of them have nutrient deficiencies, vitamin deficiencies. So if we can figure that out and supply the brain what it needs, the fuel that it needs at the right time, it can grow and create new brain connections much faster with neurofeedback.
It's just like about muscle, remember. If you don't feed your muscles the right thing, you take two people identical, you feed one the right thing to grow muscles, like protein and things like that, and you feed the other one junk, and you both tell them to go both do the same weights, guess who's going to get bigger, right? The one who's eating the right stuff. People, same thing with brain problems. There's a lot of things that nutritionally can be changed, and if you don't feed the brain the right things, it doesn't grow. And also, if you feed it the wrong things, you're going to cause damage. And a lot of people out there are feeding their kids the wrong things. So.
And that's one of the things we can do by testing is figure out exactly what they do need to eat. So these are just factors that interfere with attention and just autoimmune issues we see, neurological disorders, sleep disorders, chronic infections. I see that quite a bit. One of the largest groups of studies that have been done on these things is gluten. There's a large connection between eating gluten and having a sensitivity to gluten and ADHD, as well as many other problems. So we recommend, it just makes a lot of sense statistically, if you want to do this program, it's better to get off gluten. These are just some examples of why that is. And what we have to offer tonight is information, and